Hello, everyone. My name is Justin, and I'm going to be talking to you guys about the Mediterranean diet and its influence on inflammaging. The overview of my presentation, we're going to start off by looking at the science surrounding the topic. We'll go into the inflammatory process and the response there. We'll define the two types of inflammation. We'll also look at the process of aging and a biological definition of that. Then we'll look at inflammaging and some lifestyle influences that can affect inflammaging to include physical and dietary. Finally, we'll wrap it up with looking at the Mediterranean diet, highlighting some key concepts and how that can influence inflammaging. So the science surrounding the topic is massive. There is no shortage of information out there, no shortage of studies conducted. I typed in inflammation and aging as keywords into Google Scholar, selected since 2017, so in a very short amount of time, and it populated about 24,300 papers published. So if you're interested in the topic, there's definitely a deep, deep well to get lost in and do some reading. I highlighted three here for us because these three provided some really great, really pertinent information for my presentation. There's more references at the tail end if you're so inclined to look at those, but these three seem to be most informational. It's from Jenny, Beavers, and Casas, and yeah, these three are very good at defining some of the influences on aging via inflammation. So the inflammatory response. What is inflammation? In general, inflammation is a localized cellular response involving macrophages, monocytes, and cytokines. Those are just molecules of the immune system that help signal to the central nervous system and to the brain that we need the process of inflammation to begin. Some biomarkers are created in that process. These are biomarkers that we can use in a clinical setting, such as just drawing blood, to test for the presence and intensity of inflammation. These include the C-reactive proteins, CRP, interleukin 6 and 18, and fibrinogen. Again, those biomarkers are indicators of the presence and intensity of inflammation. Inflammation's main objective is to return the body to its physiological homeostasis. So a lot of people like to bag on inflammation, but really it's there to help us. You have two types. You have acute and you have chronic. So acute inflammation is a sudden, often traumatic, mechanical damage to a centralized area. And it brings upon these heat, swelling, redness, pain, and loss of functionality sensations. Most commonly known, or at least most prevalent, I should say, especially in sport, is when an individual with a healthy ankle is doing something extremely active, loses traction, rolls that ankle, damages the tissue to that lateral side of the ankle, and then causes some acute swelling. So that's acute inflammation. You're just going to get a lot of blood, a lot of swelling, things of that nature into the area to try to heal the damaged site. Chronic, on the other end, is a low-level subclinical process mediated by the same effectors as acute. However, it's not as in your face. So a good example of this is obesity. Obesity does cause inflammatory response, and it is very low level. So you don't see a huge loss of function. You don't see a huge heat production or swelling, redness, and pain, but it is there. So that said, if the antithesis of inflammatory is anti-inflammatory, what foods do you think may reduce or prevent inflammation? If you need a hint, think towards the med diet. So the aging process. In trying to define the aging process, there's a lot going on out there in the biological definition and the clinical definition and things of that nature, but I found Thomas Flatt's definition to be particularly interesting. A persistent decline in the age-specific fitness components of an organism due to internal physiological degeneration. Pretty much, he believes that the age of an individual and age of a human organism is defined by their ability to hunt, gather, reproduce, and defend his family or his lineage, his or her lineage. So when you start to lose those abilities to do those things, that defines how old you are, which I thought was really interesting. So I looked up the average 7-year-old in America and found that of that demographic, of that population, 68% will suffer hearing loss, 70% will have cataracts, severely decreasing their ability to survive as a human organism or their organism's fitness level. I also found this gentleman's image popping up a lot when I searched for those stats. And this is kind of the typical image we think of, loss of mobility, still able to move around, but just not as efficient or as effective as maybe he was a few years ago, potentially living in a care facility, not just to go outside, things of that nature, just not an overall healthy individual. With that said, is aging an inevitable process? And can the rate of aging be manipulated? To answer those two questions that I asked in the previous slides, we first need to understand some underlying influences on aging. Obviously, today we're going to be talking about inflammation's influence on aging, which is one of the um, primary factors to aging, one of the primary catalysts in aging, I should say. So inflammaging is the chronic state of inflammation increases as physiological age increases. So inflammation and aging have this correlation or this relationship with each other. As you physiologically age, chronic inflammation increases, the presence of it increases, those biomarkers increase. Chronic inflammation in aging comes in various mechanisms, so it can be brought on by various mechanisms, such as reductive stress, mitochondrial damage to the cells, immuno and endocrinosenescence, so degradation of your immune system and your endocrine system, and inflammatory diseases such as Alzheimer's, coronary diseases, obesity, rheumatoid arthritis, things of this nature. Can also cause weight gain, loss of muscle tone, joint pain, and loss of mobility. There's just a slew of conditions that chronic inflammation brings upon as you become physiologically older. Good news is there is some pragmatic data out there that shows that we can influence it through a few ways, it being chronic inflammation. So physical activity, when regular and purposeful, has been shown to decrease risk of many diseases, increase lifespan, lower risk of functional and cognitive senescence, and positively impact immune functions. Two studies that I found looked at age groups 17 as the youngest and plus 40. Couldn't really find who the oldest was in that one, but both showed that you can, with purposeful exercise, decrease biomarkers of chronic inflammation. So again, those CRPs, those interleukins, and fibrinogen. Just moving with purposeful 3 times a week exercise showed increases of, or decreases, I should say, of these biomarkers. So in a positive increase in influencing your chronic inflammation states. Take this gentleman for example. 70-year-old man who started to work out, definitely looks a lot more physically fit than our previous 7-year-old example, and probably physiologically is a lot less young, or a lot younger than our previous example as well. So diet. Diet has been shown to be one of the great interventions to reduce inflammatory responses. Excuse my puppy. Um, we can do this in our diet by intaking high amounts of fruit, vegetables, whole grains, fish, healthy oils, while also lowering our intakes of red meat. This has all been associated with lower rates of inflammation and inflammatory diseases. So this should kind of key us into that Mediterranean diet, especially as we climb the food pyramid of the Mediterranean diet. So on that, the Mediterranean diet's impact on inflammation. If we can recall that Mediterranean diet food pyramid here on the right, it starts with physical activity, engaging with other people, being in social environments, enjoying meals with your family, your friends, just pretty much an anti-sedentary physical lifestyle, something that's very important to the Mediterranean diet, and as we learned, is also very important to decreasing inflammatory biomarkers, increasing lifespan, and physical functionality. Key components in terms of food to the Mediterranean diet is plant-based foods. So we're talking fruits, vegetables, whole grains, legumes, and nuts. Decreasing butter in most cases, while increasing the healthy fats from olive oils and canola oil, things of that nature. Using herbs and spices instead of salts, which is huge, right? Getting some good fluid movement, so decreasing that sodium. And limiting your red meats, we talked about that. Eating fish and poultry, and things of that nature. Again, that all kind of comes back to what the research is telling us on what types of foods and what type of diets we should be following to maintain a anti-inflammatory state, increasing lifespan, decreasing inflammatory disease. The Mediterranean diet has been constructed very, very well to combat subclinical chronic inflammation. by way of physical activity and the foods that are key to the diet. So, in summary, just remember that chronic inflammation is associated with decreased physiological and cognitive functionality, increased morbidity. And to answer the questions again from 1 and 2, anti-inflammatory foods, just think about the Mediterranean diet. And yes, we can positively influence the rate of aging by way of physical activity and consuming anti-inflammatory foods. Va bene? A tutto per oggi. Grazie a mille e arrivederci.